Thank you all so much for coming. We've got candidate for Palo Alto City Council, Stephen Lee, candidate for Palo Alto School Board, Katie Causey, and Dr. Jennifer Briscoe with us. We're going to discuss mental health today, and it'll just be a nice open dialogue. So Stephen, would you like to introduce yourself?
Yes, good evening, everyone. Thank you so much for joining us this evening. My name is Stephen Lee. I'm a progressive Democrat running for City Council here in Palo Alto. For the last 3 years, I've had the honor and privilege of serving as your Palo Alto Human Relations Commissioner, working to make our community more welcoming, inclusive, and responsive to the needs of all of our community. And during that time, I've worked to prioritize mental health, funding, and services from the city side. For me, mental health and homelessness are two of the biggest social issues we need to confront as a community. And if elected, I will continue to have the city be fully engaged in addressing mental health at both the young and adult populations, because I really do think we need city and the school district to come together to work on these issues now more than ever with COVID-19 and everything going on. So I thank you for everyone for joining this call, and I look forward to the discussion.
Awesome. Katie, would you like to introduce yourself?
Certainly. So my name is Katie Causey. When I wrote my ballot statement, I tried to count all the hours of volunteer work I've done in this community, and I couldn't keep track. Since I was a teenager, I've spent my time assisting families, volunteering at community organizations, and in the last years, fundraising for nonprofits supporting youth. Through all this, for over a year, I have watched or attended every single board meeting, and I've looked forward to every one because I am a PAUSD graduate, and our district knows how to create the type of ambitious, civic-minded leaders who watch board meetings for fun. As a proud graduate of Ohlone, JLS, and Pali, I know firsthand the values we instill in our students. PAUSD likes to be an incubator for firsts in progress, in technology, and student achievement. There's several firsts in my campaign. I am the first young woman to run for this seat. I am the first member of the LGBT+ community to run for the seat. And I believe I am the first member of the LGBT+ community to run as out in any Palo Alto election. This year, I am really excited to be here with Stephen Lee. It is so important to me that that both of the positions we're seeking require that we work together, especially right now. The issues our district and city are facing can't be addressed independently. They're going to require action at both the city and district level. There's no one I would rather work with than those who are willing to run for office during a pandemic, fires, protests, to advocate for our community. I'm really excited for the solutions we are going to be discussing tonight.
Awesome. Thanks so much, Katie. Dr. Briscoe, would you like to introduce yourself?
Sure. Hi, I'm Dr. Jennifer Briscoe. I am the current vice chair for the Commission on the Status of Women for Santa Clara County. I'm also an advisor for Lead Filipino, which is a grassroots nonprofit organization here in San Jose. And I'm also a 2017 New Leaders Council Silicon Valley Fellow. And I've been on the board overseeing the recruitment and selections team for, I think this is my 4th year. So we're about to select our 2021 class very soon. And so that's all my volunteer stuff. So just like you, Katie, lots of volunteer stuff. I am the administrator of a mental health organization here in San Jose, Telecare Partners in Wellness. So I represent mental health. My program oversees the top 3% of the highest adult utilizers of emergency psychiatric services in Santa Clara County. So my active enrollment right now for clients who are seriously mentally ill and have a substance use challenge, I have 170 clients that we support and to keep them stably housed in the community, keep them out of emergency psychiatric services, and provide intervention support in the community. So I'm definitely very passionate about mental health. I also was with Head Start, 2 Head Start programs, one in Fremont and one in Oakland, collectively for about 17 years, overseeing health and mental health services. So definitely, advocating for brown children, Black children, Hispanic children, especially the boys, making sure that, they have socialization, they have a safe space in the classroom, and mental health support. So now my continuum from early childhood education from birth to 5 years old, and now I'm in a program where I oversee the adult population. So it's been a nice kind of trajectory around human development in my work in mental health. And I look forward to our discussion, and I'm excited for Stephen running and Katie meeting you and Stefan leading the way.
Awesome. Thank you so much, Dr. Briscoe.
Jamie, can I start with a question?
Yeah, so yeah, go ahead.
So Dr. Briscoe, I think you touched on this a little bit in your opening statement, but I'm wondering if you could elaborate in terms of some of the inequalities that we're seeing in terms of both access to mental health services, but also just the stigma that might exist in different communities of color or different economic backgrounds. And so what are the gaps that you're seeing there, and what can we do at the city and school district level to make sure that all kids, regardless of their racial or economic background, get access to the mental health services that we think everyone on this call thinks should have access to?
Yeah, I mean, for sure, you know, everybody's dealing with, in their own way, dealing with COVID. And I believe that mental health has been more of a priority than it has ever been, especially with young kids suffering from depression, anxiety, adults as well. Yesterday's orange sun, and right, that kind of just threw everybody off, but those little things end up being big things. And you know, when you're asking about, Stephen, access, the gaps, what are they? Definitely the accessibility, but the accessibility in the places where these communities are at. So our previous conversation, we're talking about libraries, you know, where these communities could reduce any barriers around transportation if it's in their neighborhood. And I think the gaps of what we're seeing and what we can do around specific ethnic groups, especially the Black community, and the fairness and the equity and systems that continue to oppress certain groups like Black males. I think definitely that all comes together with mental health services, and the bridge between mental health services and policing, how that comes together around that community support, because we need the police, but we also need the police to be more sensitive and more aware of mental health issues and how to deal with crisis. So if there's a way that we can have a stronger relationship and active communication between the police department and mental health programs coming together to address crises in the community more effectively and more supportively. Because here in Santa Clara County, there is a crisis mobile response team that has licensed clinicians that go out once they're called on their hotline, will go out into the field to go meet the client, but they are also escorted with a police officer who's been trained in mental health. So together, they're able to support that client so they could determine really quickly if it's a medical concern or if it's a psychiatric concern. Now, if it's psychiatric, you already have the mental health professional there that can write a 5150 hold. The police could do that too, but they feel more comfortable, of course, because that's not their area of expertise. And no one ever thought that the police would, you know, have to deal with mental health issues, but it's something that's here in our forefront and it continues to be. So it's how do we change the mindset and how do we build trusting relationships with the people that are supposed to support us, the police, and our constituents of even wanting to talk to the police, and bringing in school boards, right, around accessibility, around internet. So if we have to move to telepsychiatry or telehealth, which, you know, a lot of mental health agencies had to since March, is the adaptability and flexibility of making sure that internet services are provided. Students, kids, adults have laptops. Do they have phones that are smartphones versus a flip phone? And yeah, so for me, collectively, Stephen, your question touches for me many aspects of the multifaceted, so complicated system. And it's like, where do we start? And that I really
Yeah.
do appreciate this conversation.
Well, and you know, that points to just, you know, as you mentioned, all of these issues are so inextricably linked, right? So when we think about policing, when we think about mental health, when we think about our schools, about our community services, we like to think of them as discrete items, but they really aren't, right? So they're so inextricably linked. And, you know, to your point about the county crisis response team, that is a good example of a model that is working in our very county. And so, you know, from a city perspective, you know, I'd love to see us look at how do we bring some of that, some of the lessons learned there to our police department, whether it's leaning more and funding the county response team or creating our own based on the model that they have set up at the county. But I know we covered a lot of different topics in there, so I want to make sure Katie has a chance to pick out the elements that she wants to.
Oh my God, you just covered so much, and it's all things that I'm really excited about. I think like, where to start? I think since we are on the subject of policing, I guess one of the things that I'm going to be looking for with my district is, so our district has spent the last year, our board has spent the last year drafting the PAUSD promise, which is both our mission statement and it's our mission statement and how we're going to measure success. And we say that we are going to oppose systems of systemic oppression in it. And I think that raises a lot of complicated questions about what our relationship is with the police. I've worked on local gun control issues motivated by school safety. So I know right now there are issues that I feel like only the police can respond for. And I also feel like the police should not be the first ones to respond to mental health calls on campus. I think it can be a lot more approachable to have somebody to have a mental health professional. I think the question I'm getting to is,
well, we know that the outcomes are different, right? When police are on campus in terms of minorities and students with different abilities, right? The numbers show that it just doesn't work, right?
And it's difficult because I always encourage students. I've talked on, I follow all of our students who are on Instagram. I follow them on Instagram through my campaign account. I talk with them about issues like mental health, and I always talk about how I'm using therapy during this time, like how I'm keeping myself organized, working on an intense project. And it's hard because I also know that there was a rally for mental health that I attended at Stanford over a year ago. And there were so many Black and brown students who talked about, I reached out to a therapist for basic health and they called the police. And it's hard for me to come up with, I'm trying to think of what are solutions that can help us show that in our community, mental health resources are accessible to everyone. I don't know, that was kind of a lot.
I think, thank you, Katie, and thank you all three of you for the good discussion so far. I know that we pay our school resource officer quite a fair amount. I wonder if that money would be better spent on an in-house clinician for the school. Just an idea that comes to my mind.
I could actually respond to that because I believe from my understanding, actually, the month before the death of George Floyd, because of budget cuts, I believe we completely removed the SRO program from our campus. And I was happy to see that, because as we know that does not make all students feel safe. And sure enough, when I talk to students, the most common feedback I get from students is that they did not feel comfortable having an SRO on campus.
Interesting. So we had Stephen kind of kicked us off, but I had a guiding question to kind of start the conversation. And so I'd like to go back to that. And it is, what responsibility does the city have or the district have to its students and its community to provide accessible, low-cost mental health services? So where I'm really trying to get at there is the city responsible for the burden of any of the cost to make sure that our community or our students are getting adequate mental health services? and I'll just let whoever wants to start that go.
So from the city's perspective, I absolutely do think that mental health is a joint responsibility between the school district and our city. And that's not an opinion that's very popular in City Hall. During my 3 years on the Human Relations Commission, we've been responsible for making funding recommendations for various social service programs and for reviewing emergency applications for funding. We had a couple of instances where nonprofits came in and asked for emergency funding after the tragic suicide after the second day of school. And there were people on my commission, people in the city, who didn't think it was the city's responsibility to step up and provide those additional resources, which is, it perplexes me. So from my perspective, whether it's teens or adults, they are all members of our shared community. And we as a city have a responsibility to not only fund these important services, but to do everything we can to ensure that people are looking after their mental well-being. So my answer is absolutely yes. The city does have a role, and we need to step up more in the years to come, in particular because of COVID.
Yeah, and I'm gonna bounce right off that, because I think it is important, like when we're tackling a big issue like systemic racism, like mental health, we can't be acting independently. It takes both of us. And if we do something, if we establish a lot of work to have safe spaces in our schools, it doesn't matter if that's not matched at the city level, and vice versa. And I'm running because I was a freshman in high school during our district's first suicide cluster. And I'm so proud of the strides our district has made in mental health since I was a student. That's reflected in our California Healthy Kids surveys. We're seeing more students comfortable reaching out to therapists, and I see that when I talk to students. But it's really important to me that during budget cuts that we don't cut mental health resources, and that during what I would like to see on my time on the board is that our social and emotional curriculum, that it's not a box we check, that it mimics what the basics you would learn in a therapist's office, and that starts very early, that starts at the elementary school level of learning really basic things, how to identify your emotions. And we've seen other districts do that, and that it is like thorough and integrated. And I think that will help us in making sure we're not just catching kids right before they're in crisis.
Can I follow up with you with a question that I have there? One thing, for context, I'm also a PAUSD alumnus. I graduated just 2 years behind you from Pali. And one thing, and I'm also a preschool teacher. And one thing I think is super, super important is the need for another class, kind of like living skills, but more focused around mental wealth and well-being. And I think it needs to happen much earlier, because when I was in high school, you had to take one semester of living skills at some point during your high school time. And most people would take that their second semester of senior year as an easy A. And I would love to see a mental well-being class, kind of like living skills, in 6th grade or maybe 5th grade. I was thinking possibly replacing Wheel, or like having it be a part of Wheel or something. What are your thoughts on that, Katie?
I think that's a really great idea. I think that, like I was saying about our social and emotional learning, if I briefly fall off in 5 minutes, I'm so sorry. I have my computer on, what is it, like time constraints, and I always forget that 7:30 it shuts off, but I'll be right back in. But I think that right now my issue with our social and emotional curriculum, and again, these things take time to adapt. And the feedback I'm getting from students is they like it, but it's siloed, it's one-offs, it's things like lectures, and we need things that are more integrated. And I definitely would be open to approving an actual like full class, not just curriculum.
I mean, that speaks to what we were saying earlier about how all of these issues are so interconnected, right? And so there's a temptation just to have one class on it or to check off the box. But this is something that we need to address at all levels and all aspects of our community, right? And so in all of the different teen services and programs that we're offering folks, I mean, they themselves serve a good mental health purpose, but we need to make sure that when we're offering those programs, offering those services, that we always take into consideration mental well-being as well.
Awesome.
And I'm so excited because I need to jump in because
Yes.
Jamie, I didn't know that you're a preschool teacher. I mean, you just heard me talk about Head Start, and I was with Head Start for 16, 17 years. And I absolutely agree. Mental health needs to start earlier. So I'm talking 2-year-olds, 3-year-olds, 4-year-olds, 5-year-olds, because when you think about the classroom environment, right, the social emotional ability for kids that young to, number one, build peer relationships with each other. That's part of mental health. So if you think about a 3-4-year-old child that cannot or does not understand or doesn't have the skill sets to build a relationship with somebody else, you grow that child up from 3 years old to 21. Who are we getting? You're getting someone that's depressed, isolated, doesn't trust anybody. So when I was in the classroom, because I oversaw health and mental health and mental health services, I would do observations in the classroom the first 2 to 3 weeks of school and pay attention to the kids that were doing a lot of solo play. I would engage them and say, hey, can I be your friend? And they're like, yeah. I'm like, you know what? Because all your other classmates, all 16 of them are my friends. So if you're my friend, that means you have 16 more friends. So let's go make some friends. So a lot of role modeling, right? Because you think about also not just what's happening in the classroom and for a child just to be a kid, but with adverse trauma, you take it to their home. Now, do they live in a safe environment? Do they have parents there that are involved? Do they have family? Do they have siblings? Or is that 3, 4, 5-year-old kid an adult once they leave the classroom, that they have to cook for everybody, they have to clean for everybody, and they know they have to fend for themselves? So definitely, so to come back to the original question of who is responsible, the city, school board, or school district, I agree with everything that has been said. It is everybody's responsibility. It is the city's responsibility to find the funding. It's up to the county to help the cities, because we all live in this community and we need to do something about it now.
Dr. Briscoe, I wanted to ask a follow-up question. So how important is it for our city and our community to provide services to adults, and for adults to actually utilize them and understand their own mental health, sort of connecting it to, when they have kids, when they have young people in their household? How important is it that the adults and the parents in that dynamic are taking care of themselves from a mental health perspective, and in terms of them making sure that they know what to look for?
Yeah, so that's the parent involvement. I definitely believe that, a lot of parents learn how to be a parent once they're a parent. There's no training book, right? And to tell you what's a successful parent. So, when you make mistakes along the way, hopefully you learn, you don't repeat them, because your child is the one that's absorbing that. So for me, it's the adult population that are the parents is equally important, because those are the adults that are supposed to be role modeling trusting relationships to these kids. And another part of accessibility is a person wanting services. So in mental health, we talk about the stages of change. And that's meeting the client where they're at. Are they in denial? Are they ready? Do they even know there's things that they need to work on? Or do they just think, oh yeah, but I'm not ready yet? So contemplation. So it's really looking at the stages of change and where people are at in their ability to want to make change and ask for help. Because once they're able to get through that door, then they're able to be met by a therapist or a mental health clinician or a treatment team, whether that includes a nurse or nurse practitioner or a psychiatrist that'll prescribe medication. It's all of those people coming together to support that adult client that will be supporting, their own kids or their own people that live in their own house. So yeah, equally important is the adult care. So thank you.
Yeah, I mean, I feel like as adults, we don't talk enough about when we need help or about how we're doing mentally speaking, right? And so we kind of bottle it all up, and we're not modeling good behavior either for each other as
Right.
adults or even for our kids.
Right.
And I know in our school district, there's so much of the pressure is to, study hard, get good grades, get into that good college. But if we as adults are not modeling, if we're modeling that same sort of tension, right, in terms of got to work late, got to get that promotion,
Yep.
and we're not showing our young people about the necessity of taking care of ourselves and that work-life balance, it becomes this perpetual kind of cycle, right? Yeah. So, and I certainly think, one of the things we can do as a city, our city employs 1,000 people, right? Mm-hmm. And so as an employer, beyond our role just as a city, but just as an employer, we need to set a mm-hmm. good example for our employees and making sure that our employees have the resources that they need, that they're actually taking time off for themselves and not just overworking themselves because they think, oh, well, there's this deadline that I need to do, or this task mm-hmm. is so important, right? We need to be, as an employer, good role models and provide the support for our employees so that it trickles down to other parts of our community.
Absolutely.
On that topic, I know, Stephen, you and I and Dr. Briscoe, you've been on a call with us while we've discussed this. We're interested, or you're interested, Stephen, if on council, like doing a once or twice a year training to employees on mental health issues and the importance of mental health issues. Is that correct?
Yeah, I mean, I would totally be in favor of more training. I think, again, we don't talk about it enough as adults. And so, we need to refresh ourselves on what the current thinking is out there, both for ourselves as people, but also as a city that has a lot of community-facing employees. It's important that they understand these issues so that they can identify if they are seeing particular behaviors in the community or as they're just interacting with people. Right? So it's important for both reasons. Yeah.
And Katie, I'm not sure, you'll have to fill me in, but is that kind of training something that our teachers currently go through? Do our teachers get a training in not just student mental health, but their own mental health?
That's a fantastic question. And I actually don't know for sure. And I know one of the areas where we've been needing to support, and especially when I talk about when I was in the district, during the first cluster, is one of the areas that I keep hearing brought up again is like, nobody talked about how the teachers were being supported during that time. And I think that is an area that we do continually overlook. Yeah.
I mean, I remember when I was a student, hearing a lot of parents in our community vilifying teachers for their homework load or whatever it was, and a lot of the times blaming teachers or the school for the suicides. And I mean, I think there's plenty of blame to go around, but I always had a really hard time hearing that when I had such close relationships with my teachers, and I had teachers who lost students and I could tell weren't handling it super well. So if the district doesn't already provide mental health training for teachers, is that something that you would be interested in improving or getting on track?
Absolutely. And I think you touched on a really important issue that I think it's so important when we discuss community issues, when we're discussing something really big like mental health. I had somebody message me the other day and they were really concerned. They wanted me to specifically address, they were like, anytime that we have a mental health crisis in our community, there's kind of like, we blame the teachers. There is racism that's directly targeted Asian American families, being like, it's this type of family who puts pressure on their families. I'm white, we do not talk about it, when it's like we never mention when white families put pressure on their kids. And we like to say it's one type of person's responsibility. And that is just not the case. It is not helpful to point fingers or try to make a racist scapegoat. It is about talking about solutions that we can make right now. And I think the idea of having teacher training, that is just an easy way to start.
Awesome, thank you.
Can I ask another question to Dr. Briscoe?
Yeah.
How do you think the housing crisis is impacting our mental health, in particular on teachers who can't afford to live close to the communities that they teach, but also just for mental health professionals? are you seeing it impact our ability to actually attract and retain the types of professionals we need now more than ever?
Well, because I'm gonna start off kind of big and then I'm gonna
Yeah.
come back in, all right? So one of my issues right now with Congress is they went on break. Why did these people that we elect into these positions decide that the crisis of COVID-19 is not important enough to pass something to support the community? They went on break, right? So how the rents, mortgages, you're talking about millions of people that every week are applying for unemployment benefits. However, their bills are still due, their rent is still due, their mortgage is still due, but yet Congress went on break. So I think the statistic, March, April, May, I think it was like 40% or so of people didn't pay their mortgage. Now, yes, eventually over time, now you're thousands of dollars behind. Now it's going to be more every single month. So the fear, if people have not been evicted yet, the fear knowing, number one, they don't have any income, they're barely getting food on the table. So coupled on top of all of that is, where's the safety nets? So housing, yes, I think that we're going to see a big, crazy influx of people that will be losing their housing very, very soon, which is worrisome because where are they going? What are they going to be doing? What about the kids that live in their homes? How are these people going to find jobs when it's so hard to find a job right now? So how me is huge, and you could tell I have a bone to pick with Congress. That's why I'm happy that you, Katie, are running in there, Stephen, you're running in there, because we need change makers. We need people that understand what's happening in the community and that reflect the community and care enough to know that y'all were elected into those positions and you are to represent your people.
And can I just ask a clarifying question there? So a lot of people are going to be forced out of their homes. Is there a strong correlation between housing insecurity and an uptick in mental health services, or an uptick in the demand of mental health services?
Yes, I definitely would say people that are in crisis. We've noticed it already in our own programs of telecare. More suicide ideation, more suicide attempts. People are isolated, they're depressed. And people dealing with the pandemic and then dealing with with the sense of what the new normal is. I can't see people like I used to. My housing situation might be impacted, food insecurity. So all of those things collectively, if we just target housing, other things come alongside with that.
I think you just mentioned so many important things, and I'm really glad to see the discourse, because this month is Suicide Prevention Month, correct? Yeah. And one of the biggest changes in discourse I've seen this year is stop making it about, checking in on friends is great, but accessible mental health care, housing, accessible resources, those are suicide prevention methods. And does come back to those. I wanted to ask, because you mentioned something that's really important to me. So I've worked with the Junior League of San Francisco since January 2019, and their focus area is youth social isolation. And they see that as a huge underlying issue in the Bay Area. And I saw this happen. I grew up here. When I was growing up here, most people could afford to only have one working parent. And then as I got older, you need two working parents. And I saw this with my friends babysitting. Is like, some families, they have to work so much to afford to live here. It's like they don't get a lot of time with their kids, and we are seeing more social isolation. I guess my question is, bigger, broad question, but I guess, what would you recommend, what do you want to see school districts doing this time? And then also, what would you recommend for students to maintain their own mental health during this time?
Or if I could just jump in there for a second, I think, we also see the social isolation in particular among our senior population, right? And we have a growing aging population in Palo Alto, in California. And because of our inaction on housing, because we haven't provided enough senior housing options, we see that a lot of seniors end up being isolated in these homes that are too big for them to manage now, which worked for them when they had kids, but now they're stuck in the suburbs, right? And yeah, so just wanted to interject there, but sorry, go ahead and.
Yeah, what can the district be doing, or what do you see the district doing, and how do you see kids being able to help themselves?
So I think we go back to our first question was what kind of supports can be at the ground level with the students within the school. So Jamie, you said something about possibly with the school resource officer. Maybe that's not the person. Maybe the person is a mental health professional. And then Katie chimed in and was like, yep, we did that. And I would also say that for the mental health professional on site at the school to reflect the kids in that school. Because that's the number one reason why I became a therapist. So I'm a licensed marriage and family therapist. And the reason why I became a therapist is because I, as a teenager, I believe I was depressed, but I didn't know that. I was just really, really angry. But I didn't feel comfortable talking to my counselor at school because he was a white male. I didn't think he understood me. And and then I went to private school as well. And that was the people that we were supposed to go talk to. And so for me I never sought out mental health support until I came into my master's program and had my own psychotherapy. So that kind of comes up for me as far as, what the school districts can do. They can prioritize mental health services on school now.
Awesome. And what can the students be doing? Like, is there a responsibility or is there anything that the students can be doing to improve their own situation?
I think students speaking up, reaching out to other students that maybe are more isolated, and just supporting each other, because all those kids are going through something right now.
What about like a student run email hotline or text hotline where I don't know, that's just an idea.
Something where they could connect really quickly.
Yeah.
Well, I wanted to connect what you were saying in terms of students speaking up to something that our community has started working on earlier in the year, and that's related to teen vaping. That was a issue we heard from our young people on our city's youth council about, and it's so interconnected to the issue of mental health, right? It's often used as a coping mechanism or a stress reliever, and so that's a great example of where we heard from our young people and mobilized not only the school district but our city as well, all of the various stakeholders in our community to tackle the specific issue of teen vaping, but as it relates to the larger issue of mental health.
And Jamie, I would like to add, you asked me what the students can do besides speaking up, is maybe formalizing some type of group in some kind of way so that it's student-led, it's peer-led. And I do want to kind of just offer this information is Santa Clara County, the Office of Women's Policy, they have a group called the Girls Advisory Team. And this was a thought by Quetzal Gomez, who's also running for Santa Clara County School Board. About 3 years ago, she wanted to bring the girls their voices in a place where it was supportive. So it's a leadership program over the course of about 10 months. They meet one weekend every year, and it's every year they have, first year I think they had 30 students. So these are female students that are high school or early college. So we're getting them right there at the cusp of like becoming adults. And here together, they build their own community, but every year the cohort grows so fast. And what I realized, because I'm involved in that, is they have female students from different schools around Santa Clara County represented all together. And they do a community project, and they reach out to us as a commission that we're hoping that they will get involved in the commission as well. So I think that's one way you can mobilize, is individually bringing them all together in a group to represent the whole, because then you get the voices of all students at all schools.
Oh, I love all of that so much. All of that is just so important. Especially earlier this week, we were having a town hall on youth issues, and we were talking about, you know, organizations you can reach out to if like maybe you're not connecting with your own peers on your campus. And I think resources like that, where students from all over are just so important. And I really like the idea of having students be able to reach out to each other. I wanted to bounce off the two populations that the Junior League works with. We work on elderly social isolation and youth social isolation. And during this time, I've had many elderly people saying that they would like to find ways to support students during this time, because they have the time to support students and they're feeling isolated too. And I think what Stephen was saying earlier about vaping, I've pushed so hard in my campaign to emphasize the importance on like really relying on healthy coping mechanisms during this time. And I would really like to see our school district, I feel like we haven't stayed ahead of vaping. When I talk to recent graduates, most of them say that their friends were already addicted before they graduated. And I think we do need to be more, I think in our own district, we need to be more proactive about the resources we have available for young people struggling with substance abuse.
Yeah.
Awesome. Thank you, Katie. I have 2 more questions, and we have about 12 more minutes, so I think we should be good there.
Remember when we said we were only going to do 20 minutes?
Yeah, no, this turned out great. Yeah, this turned out great. There's a lot to talk about on this issue. So my first question, I know Stephen, you and I have talked about it, and Jennifer Dr. Briscoe has been a part of those discussions. Creating possibly a city holiday in honor of mental health, and having it be a day off for city employees, and finding ways to incentivize local businesses and whatnot to also take the day off. Katie, how would you feel about the school district participating in a mental health day where teachers and students get the day off, and there's an emphasis maybe the Friday before, if it's a Monday or something, on do something this weekend that is like, you be aware of your mental health and do something that is positive for your mental health on this day. What do you think about that?
I really like that. I think that's a really cool idea, especially because what I'm looking for, if I am elected, is how the board can collaborate with community efforts. And I think that's a perfect example of something that we can do as our entire community, something that's not just about what the city does or what the school district does, but something we do as an entire community to emphasize the importance of mental health.
Awesome. Stephen, do you want to talk on that at all?
No, I definitely, I love that idea. It's a way that our local governments can set a good example for all of the other employers in our community, and really catalyze sort of a new movement about mental health. And I think more generally speaking, we also just need to make sure that we're encouraging people to actually take time off when they need it. We live in a culture where it's like work, save up your vacation time, or you have unlimited PTO, but you never actually use it, right? And we actually need to encourage people to use it, whether it's our city or school district employees, whether it's our peer group, and saying like, hey, Christine or Jamie, when was the last time you actually used one of your days off, right? So there's a lot of things that we can do to actually encourage that. So I certainly be in support of a specific holiday where we say this is a mental health day, but I think more generally speaking, we need to cultivate a better work-life balance.
Awesome, thank you. And then my last question, if we have a little bit more time, we can maybe ask another, but I'd like to hear really quick, just in 1 to 2 sentences, Stephen, you first. There's a saying that like mental health services has long been a reactive area where people there's been crisis and then people respond to that crisis. What is one thing or 2 things that you would do to make Palo Alto a more proactive place to deal with mental health?
I mean, that's a very good question, and I'm going to try to answer in 2 sentences. But as with most things in government, too often we are reactive as opposed to investing in all of the proactive programs and resources we need to prevent these incidences from actually arising, and which actually end up saving us more money in the long term, right? So it's funding things like community services, things like our children's theater, things like our recreational programming, things that help get kids sort of out of that academic mindset and get them to enjoy all of the bounties of our community and just to be kids, right? Just to enjoy life and be kids and not think about, getting that 1600 on the SATs or getting into Stanford, right? It costs us as a community a lot less if we preserve and maintain and enhance those sort of preventative services than it does just paying for services on the back end after something has happened. Mm-hmm. So if anything, it reinforces the need in my mind to support all of the amazing community services that we have, in particular those that serve youth, as a part of that mental health equation. Right?
Awesome.
Was that 2 sentences, or how many sentences?
that was probably 16 or so.
Sorry about that.
But no,
right?
yeah, I know, Stephen, you're verbose, but we appreciate it. Katie, same question to you. What would you do to make the district more proactive about mental health?
You've got 2 candidates here tonight. I'm not going to answer this in 2 sentences. That won't happen. I think, especially thinking about the immediate moment, one of the reasons that I organized alumni for current students when I declared was because I think that is going to be such a strong way to combat anxiety and mental health. I also think it'll have a lot of really practical applications outside of mental health. I think when you have a teenager who's in an anxiety spiral of, oh my God, if I, get a C on this test, that's going to cost me I'm going to not get into this college and who knows what'll happen. And there's so many recent alumni, 5 years out, who can say, I got a C on that test. And then I showed up to my college interview. This is what I did. When I apply to jobs, these are the things I talk about, because you are always going to have opportunities to show people that you are professional and you're reliable. Your life is no way. That's anxiety talking when you start thinking like, this is going to define everything. That's catastrophizing. And I think having alumni to give students that input, I think that is going to be really helpful. And I think that will help with combat social isolation. The other thing I'm looking for more long-term is how we continue to strengthen our social and emotional curriculum. I think that's going to really depend on communication with students and educators, especially if educators need additional support to strengthen that curriculum. And that's hard because that is a long game, but I think that if everybody collaborates, we can come up with social emotional curriculum that mimics what you would learn in a therapist's office really early.
Awesome. Thank you so much. And Dr. Briscoe, similar question to you. What would you like to see cities and districts do to be more proactive as opposed to reactive?
So when Council Member Stephen Lee takes his seat and School Board Member Katie takes her seat, they have great creative ideas, mobilizing the community, getting people involved, not looking and investing in current mental health programs or finding more, because we need more of them, obviously, finding funding, and getting teachers paid more, because they should be the highest paid profession, because they're with our kids for 12, 13 years, should be the highest paid. And it would be great if around the mental health day that we're all talking about a question ago, but I want to bring it right here, is if Palo Alto could be the model city in response to this global pandemic, social isolation, to be the innovators, to say, you know, we recognize it, we're one of, you know, pretty wealthy city, we see it, and we have demanded a mental health day for all employees, and this is the reason why, and this day is specific for that person or that kid or that adult to reconnect to their family, spend time with their family, or, you know, do whatever you need to do to take care of yourself, because we understand that mental health is our priority for you. And because, yeah, you're right, we don't take vacations. I feel guilty when I take a day off, and I hardly ever do.
Don't feel guilty. Don't feel guilty.
I know. It's like, why do we feel that way? And we should be in a place with city council, school boards, to say, you know what, everybody deserves at least one day to like do nothing or do something, but do something that you want to be doing, because it's your time. And we recognize that, and we want to pay you for that day because you give us the other 363 days of the year.
Awesome. Thank you so much, all three of you. Like Katie joked a few minutes ago, I think we were originally planning on doing maybe 20 minutes, but we've got such smart people and great ideas, and I can't wait to see Stephen on council and Katie on school board, and listen into the meetings where they're going to be doing their excellent work for our community. So thank you, everyone, for spending your evening with us and discussing. Any final comments from anyone?
Yeah, I just want to thank Dr. Briscoe. Thank you, Katie, for joining this call, Jamie and Christine, and everyone else on this call. Thank you so much. You know, as we, we're having this conversation about mental health, we weaved in and out on so many different issues, and it just speaks to the intersectionality of mental health with all of the other issues we care about as a community, and about the need for us to work together and more closely with all of the different partners in our community, whether it's the city, the school district, agencies like yours, Dr. Briscoe, all of the amazing people in our community to address these big and challenging and intersectional issues. And so I look forward to working with all of you in the future to continue this important work.
Awesome, thank you. Katie, do you have anything you want to close out with?
Oh, I was going to ask Stephen a final question, and I'm happy to answer too. If I hope this doesn't put you on the spot too much, but I'm curious. We are both candidates. Campaigning is really, really intense, and we're doing it during global crises. I'm curious, and I'm happy to give my answer. How are you managing your mental health during this time?
Yeah, I am leaning on my roommates quite a bit. I force them to watch movies with me on Netflix, and I'm having them rewatch some of my favorite TV shows with me. So we're rewatching The West Wing right now. We're watching The Crown together. My roommates tend to work a lot. So I do it not only for myself, but for them as well, and say like, hey, you've done enough work today. Let's power off the devices. Let's, well, I guess you have to turn on the TV. The TV is a device and watch Netflix, but turn off the work devices and really just spend some quality time as three roommates enjoying the immersive experience of these stories. So that's how I, when I'm not campaigning, I'm busy Netflixing with my roommates. Yeah, and sometimes we throw in some rosé in there, but
only if you're legal age.
Yeah, only if you're legal.
Katie, what are you doing?
What are you doing? Yeah.
I'm very fortunate, and I know this is something not everybody has. I have a very fantastic therapist, and I talked about this on my campaign social media. But when I was at my mentally healthiest, I reached out to her, and that's when I met her, and I said, I'm going to run for office at this date. if you see, let's have a few sessions, let's establish a baseline for my health, just like you would with a doctor. And if you see something in my mental health that you think would prevent me from serving my community, let me know and let's work on it together so that I am ready to serve my community. And I'm really lucky I have her. She is also actually did her mental health training at PAUSD and has been really fantastic. And I think for me, what we've covered by doing that work when I was at my healthiest is, for me, it always comes back to keeping myself on a routine. And I think if you're a teenager, if I was a teenager and I heard that, that might not really resonate with me when you have so much going on. But really for me, 90% of the time in the last like year, anytime I'm having anxiety or a lot of OCD symptoms, which is something that I have, it comes back to just, okay, let me try to put myself on a routine. And usually in less than 2 weeks, I'm like back to being super level.
Awesome. Well, I'm glad to hear that both of you are staying healthy. Two very different strategies, but there are a lot of different strategies to deal with it. I've got a mix of both. I definitely might really appreciate my therapist and my psychiatrist, but I also definitely enjoy my Netflixing. And so, yeah, thank you all
My
so
roommates
much.
were like, have we watched enough? I'm like, no, there's so much more to watch.
Endless
No.
content,
Endless
endless
content.
content in this universe.
Yes.
All
Well, thank
right.
you, everyone.
Thank you so much, everyone. Have a good rest of your evening. Bye.
Bye.